Hi, my name is Orly Piton, and this is my presentation on myasthenia gravis. So what we're going to cover today, what is myasthenia gravis? What are some of the signs and symptoms? Who does it target? Whether or not there's a cure, and what some of the possible treatments are. So what is myasthenia gravis? So looking at the medical terminology, my means muscle, asthenia means weakness, and gravis means grave. So when we put all that together, we see that it is an autoimmune disease that causes severe muscle weakness. So what are the signs and symptoms? So signs are things that can be outwardly observed by a practitioner, and these are things like ptosis and ophthalmoparesis. Now, symptoms are things that only can be felt by the patient themselves, such as diplopia and bulbar weakness. Now to look at some of the background physiology in order to help us better understand what myasthenia gravis is and how it happens. So looking at a healthy human cell, we have a signal that travels down the neuron into what is called the synaptic cleft. Here, a neurotransmitter called acetylcholine binds to its nicotinic receptor and causes proper muscle contraction. Now, in a patient who has myasthenia gravis, that acetylcholine receptor is blocked. So in the photo titled Normal Neuromuscular Junction, we can see acetylcholine binding to its receptor, causing normal muscle contraction. And in the second photo, where we see a patient with myasthenia gravis, we see that the green antibodies are blocking that receptor, thereby inhibiting acetylcholine from binding to its receptor, thereby inhibiting proper muscle contraction. It's also important to realize that myasthenia gravis is an autoimmune disease, and what that is when the body attacks itself, and this can either happen by too much or too little activity of the immune system. For example, when we look at the thyroid, there are two different autoimmune diseases that can happen. Hashimoto's, which is when there's too little thyroid production, or Graves' disease when there's too much thyroid production. So now that we understand a little bit how myasthenia gravis works, it's important to discuss who it targets. So it can happen in both men and women. It can happen in any race or ethnic group, and it can even happen in childhood. This is important to realize because there's no specific time in someone's life that they may get this disease, and it can really happen to anyone. Now, is there a cure, and what are some possible treatments? So unfortunately, at this time, there is no cure for myasthenia gravis. However, there are multiple treatment options for someone diagnosed with this disease. So the first one is acetylcholine esterase inhibitors, such as pyridostigmines. And the way that this drug works is that it inhibits acetylcholine esterase, which is the enzyme that breaks up acetylcholine. So the logic behind it is that we try to create as much acetylcholine in the neuromuscular junction as we can so that it can compete with the antibodies. The next method of treatment would be the thymectomy, which is the removal of the thymus and can be used to combat muscle weakness that many myasthenia gravis patients feel. And it's also used as a preventative method because many people get tumors in this place. And the final treatment is plasmapheresis, which is done for patients who have a severe load of antibodies. And they go through this process, which is called plasmapheresis, in which the antibodies against the acetylcholine receptors are removed from their blood. In conclusion, I want to summarize everything we spoke about in this PowerPoint presentation. To start off, myasthenia gravis is an autoimmune disease that causes an increase in anti-acetylcholine receptor antibodies. What this does is it attacks the receptors that normally respond to acetylcholine in the neuromuscular junction. Acetylcholine then can no longer act on the receptors, and so the neuromuscular junction doesn't stimulate muscle action anymore. This causes ptosis, ophthalmoparesis, and diplopia. Because 10% of people develop thymic tumors, we treat them with a thymectomy, which is a removal of the thymus. Next, we can treat the increase in autoantibodies with a process called plasmapheresis, which essentially filters the blood and removes the autoantibodies from the plasma of the patient. Finally, we can treat the decrease in effective acetylcholine in the neuromuscular junction by inhibiting the enzyme that normally breaks down acetylcholine within the neuromuscular junction. This group of drugs are called stigmines, which increases the amount of acetylcholine that's available in the neuromuscular junction allowing more firing of the acetylcholine receptors. I hope that I was able to introduce you to this fascinating disease and give you an adequate introduction to its intricacies.